We all have days where our thoughts bounce around like pinballs, or times when we feel a tight knot of panic in our chests, or mornings where a heavy sadness makes it hard to even get out of bed. Since every single person on Earth experiences these feelings at some point, how does a doctor decide when a bad day crosses the line into a medical condition? To understand this, picture the human mind as this animated audio mixing board. In daily life, these sliders for energy, sadness, fear, and focus constantly move up and down, adjusting to whatever we face at work, school, or home. Psychiatry tracks the exact moment when our standard human traits push so far toward the edge that they disrupt our ability to live. Because the brain is so complex, clinicians group these thousands of overlapping traits into organized sections, like mood, anxiety, and personality. Let's look at one specific section of this board, called Neurodevelopmental Conditions. These specific sliders begin taking shape very early in childhood. They control how a young brain acquires skills like speaking and interacting. In autism spectrum conditions, dials for social interaction and repetitive behaviors form a stark, contrasting pattern. For attention deficit, impulsivity pushes all the way up, while attention drops. And if a child struggles heavily with reading or math, it usually means that just those specific learning dials are turned down low, even if their overall intelligence dials are turned all the way up. By organizing traits into these groups, doctors can quickly figure out which core system of a child's brain is struggling to adapt, rather than just treating a single behavioral problem in isolation. But this brings up a tricky question. How do doctors tell the difference between a child with high natural energy and one with clinical ADHD? The answer lies at the point of disruption. A medical disorder is diagnosed when a dial's position causes someone severe distress or stops them from being able to function in their everyday life. A child bouncing off the walls at recess who still makes friends and learns well is entirely healthy. But if that same energy makes it impossible to learn or keep friends, a doctor steps in. And this assessment depends heavily on the environment. The exact same traits are perceived differently depending on the cultural space. In certain cultures, avoiding eye contact is taught as a sign of deep respect. In others, a lack of eye contact might be flagged by a teacher as a social deficit. Similarly, a person experiencing deep depression in one part of the world might describe a heavy emotional sadness, while someone from a different culture might report feeling physical, bodily pain. You cannot measure a symptom in a vacuum. A doctor has to evaluate how well a person can function within the specific cultural rules of the world they actually live in. To keep these evaluations consistent across the globe, clinicians use a standard guidebook from the World Health Organization. Inside, the manual identifies the required signs for every condition, the core symptoms that have to be there for a doctor to be sure. It also highlights the line of disruption, the point where common personality quirks turn into something that needs a doctor's attention. This keeps medical professionals from mislabeling ordinary human variation. It also guides clinicians on exactly how symptoms might look different in a young child versus an adult, or how gender and cultural backgrounds alter the presentation. But a rigid checklist is never enough on its own. Good clinical judgment means putting the manual down and looking at the whole complex human being sitting in the room. A diagnosis acknowledges that your unique mix is currently causing you distress and allows you to find the right support. It gives you a map to rebalance your sound so you can finally thrive in your specific world.